we are facing the second wave of the COVID infection. Following the COVID infection, majority of the people are now getting affected with the fungal infections. It's called black fungus as well as white fungus, but ultimately these are all the result of immune suppression in the system. These funguses are not uncommon, they are not new, they have been existing along with us as commensals. They are present at all the environment, vegetables, tables, chairs, books, everything, they are present there. But after the COVID infection, there are many reasons why the infections are becoming very severe. In fact, even earlier, we have operated on mucormycosis in many situations where the people with uncontrolled diabetes, people with immunosuppression, people with cancer and on chemotherapy where there is immunity is low, they can get affected with mucormycosis where they rapidly spread from the nasal sinuses right into the eye or into the brain. Now, the similar situation has occurred in a larger number of population because of number one, the COVID infection itself can reduce the immunity. That's number one. Number two, indefinite use of steroids, and people even misused steroids, self-medications, prolonged use of medications with steroids for the COVID out of fear and out of many other reasons has reduced their immunity. Third, as it is, we have highest number of diabetics in this country, and these steroids can worsen the diabetes. And the diabetic control as such is very, very poor. I haven't seen somebody with a very high sugars telling that my diabetes is uncontrolled. They always say when you ask them, how is your diabetes? Is well under control. And each one have their own standards. Even if it is 300 blood sugar, they said, no, I'm perfectly under control for the last 2 years with 300 blood sugar. So this is the answer we get. So it is time to realize that you should consult the physician if you are on steroids, immediately adjust the dose and then monitor properly. That's the number one step you need to do. If you are a diabetic, get a very tight control. There is nothing like that. It's the borderline, we are doing well, we are under control, nothing doing. Absolute tight control of the diabetes is very important. Do everything possible to boost your immunity because the COVID infection itself makes one susceptible. And fourth, the most important thing is the hygiene. If there is any compromise on the hygienic practices, then it is bound to happen. Number one, please keep washing hands as frequently as possible. Cut your nails, both at the fingers as well as the toes. They are the most common places where this fungus can harbor. And gargle the mouth, take steam, and do not pick the nose frequently. If you are wearing masks, change the mask frequently. Do not wet the mask. If the mask becomes wet for any reason, dry it, iron it, and if there is a suspicion, please change the mask. Prolonged use of same mask repeatedly can accumulate fungus and then it can take it inside. Masks need not become wet because of the rain or water. Even the breathing itself, there is a humidity in the air, and that itself will make the mask slightly wet, which can attract fungal growth. So you need to take care of all these precautions, and then if there is a suspicion of headache, bleeding from the nose, or pain around the facial area, redness of the eye, headache, and any decrease in the vision, you must consult and investigate for the possible fungus. If it is mucormycosis, it looks black, so it's called black fungus. Similarly, candida infections look white, and it's also known as thrush. In all immunocompromised people, it can spread from the mouth all the way down throughout the intestinal system. From there, it can spread systemically into various parts of the body. These mucormycosis can become very aggressive in people in compromised immunity, it can spread to brain, it can cause meningitis, it can cause loss of vision, it can cause convulsions, it can cause a stroke, the peculiar possibility of invading the blood vessels, and it can even produce bleeding or a stroke. So it is very important to recognize this early, and if there is a fungal ball inside the sinuses or in the brain, it is better to remove it surgically as early as possible and treat them with the antifungal medications. Now the shortage of antifungal medications is bound to happen because the sheer increase in the number of cases we are facing today. Nobody will be prepared to have that many number of amphotericin vials as it was not anticipated. I hope that we will be able to cope the situation, but your cooperation in maintaining these factors can prevent a fungal infection altogether.